From KUNC and the NPR network, this is In the NOCO, a daily slice of Northern Colorado news and happenings. It's Wednesday, November 15th. I'm Erin O'Toole. In communities across Northern Colorado, people are struggling with their mental health and with getting the care they need. Over the past few months, KUNC's Leigh Paterson has been reporting on the barriers residents face in getting help. And she's here now to talk about some of the fundamental reasons why. Hey, Leigh.
Hi there.
Now, you've been reporting recently on mental health, and in particular on the state's youth mental health crisis. What have you been hearing?
I've been hearing that kids are really struggling, particularly since the pandemic. Here's some of what people have been telling me over these past months.
In the 9th grade, it got so bad. It was so terrible.
Her mood was so extraordinarily low.
Suicide rates. It's heartbreaking.
I am just concerned that there's a lot more students out there that need supports that we don't know about.
We have a whole host of therapists opting out of insurance, and many people can't afford to pay out of pocket.
Every month, I'm seeing 20-30% more patients than I was seeing before the pandemic.
I just remember the anxiety of being in that space of feeling like someone has got to help us, but where are they?
So clearly Coloradans and especially young people are suffering. The demand for services is huge, but getting treatment can be a challenge. Leigh, what are you finding about what's driving these access issues?
Well, for starters, I think it's really important for listeners to know that we actually have federal and state laws on the books addressing this. These are called mental health parity laws, and they essentially require insurance companies to cover behavioral health, like therapy, in the same way that they cover physical health, like your doctor's appointment. So this stuff relates to things like the number of covered visits, deductibles, copays, etc.
Okay, so bottom line, for many Coloradans who have health insurance, mental health services are a covered benefit. But as we just heard, the existence of these laws doesn't mean people can actually get the care they need.
Yeah, that's exactly right. I talked with Kara Cheevers about this. She's the head of behavioral health at Colorado's Division of Insurance. This is how she describes the process of getting a mental health appointment within 7 days, which is what's actually required by regulation here.
It can be really honestly climbing Everest twice without oxygen to go from the moment of realizing that you need help, and then within 7 calendar days, walking in or signing on to your first therapy session using your insurance.
This impacts the well-being of our communities. We know that around a quarter of residents reported having poor mental health in a statewide survey from 2 years ago. 14% said they didn't get needed mental health services. Nearly half of that group said they had a hard time getting an appointment. Nearly 60% were concerned about costs. So those are just some statistics that I think illustrate the stakes.
Well, what is driving this then? Why is there such a big gap between what the law requires and the care that people can actually get?
There are several reasons, and I'll start by giving an example. So let's say you're feeling really depressed and you decide, okay, I'm going to start seeing a therapist for the first time. You log into your insurance portal, you pull up the list of therapists who are in network covered by your insurance, and you just start calling around.
In that process, you might find out that that person is no longer a network. It may be that they're not even in your state. It may be that they're not even real.
So Kara Cheevers here is describing something that's called a ghost network, meaning a list of providers from insurance companies that is inaccurate, out of date, and kind of useless. Even though Colorado regulation does require companies to regularly update their directories, it's still a huge problem here and elsewhere around the country. The Division of Insurance right now is actually working to determine the scope of the ghost network issue here so that perhaps it can start doing something about it.
Wow. Well, Leigh, on top of this directory problem that you're describing, are there even enough providers to begin with?
No. In many of our rural communities, there just are not enough therapists, counselors, psychologists to meet the need. But I think maybe one of the larger issues is that in most communities, we do not have enough in-network providers, so providers who take insurance. In some cases, insurance reimbursement rates are too low. For many, the process of getting in network, which is something called credentialing, just takes too long. Now, over this summer, the Division of Insurance asked companies to speed up and simplify the credentialing process. There's also an effort to get more pre-licensed counselors in the mix here and covered by insurance. So that means a therapist who doesn't have her license yet is able to see clients under supervision. And that's seen as one way to address the behavioral workforce shortage here.
Well, is there anything the Division of Insurance can do to enforce parity here?
Yeah. In 2019, Colorado lawmakers passed a bill which greatly expanded parity laws and actually gave the division more enforcement power. That's when Kara Cheever's job was created, and her department now has 3 employees working on this stuff. Now, on enforcement specifically, the division does things like reviewing copays every year and pharmacy benefits. They issue regulations, they issue fines. But as we've been discussing, people still have trouble getting mental health care. Cheevers explains this by saying this kind of change is just slow.
A lot of times policy change is not sexy either, right? Like to say, oh, we amended this regulation and now we're collecting data on reimbursement rates and da-da-da. To someone experiencing crisis or someone who's struggling to get out of bed, like that doesn't land. I don't care. Like, I need to know how to find a therapist right now. That is, I think, the inherent just push and pull of systems work and systems change.
Now, have you found that Coloradans are aware of why it can be so difficult to access care?
I think most people who have tried to get care have encountered difficulties. But no, I don't think that people are necessarily aware of their consumer rights when it comes to behavioral health. I'll reference again that statewide survey from 2021. 70% of people who didn't get needed care said they didn't think insurance would cover it. So that is clearly a huge issue. Kara Cheevers describes the stakes of it all as life and death.
We can quantify the way in which delayed mental health care impacts a person when people are struggling, whether it's with depression, anxiety, substance use, opioid use. We don't have healthy communities. We don't have a healthy neighborhood. We don't have a healthy workforce. We're not well.
Now, residents should know that some help is out there. Colorado actually has an independent behavioral health ombudsman. This person's job is to help people navigate our behavioral health system. They gather data, they investigate concerns, that sort of thing, and that person is available over email and over phone. For insurance questions, the division does have a consumer services team that is also reachable over the phone or email, and it is through the division that you can file a formal complaint related to insurance coverage of behavioral health.
KUNC's senior editor and reporter Leigh Paterson, thanks for looking into this, and thank you so much for talking with us today.
Thanks for having me.
KUNC is part of the Mental Health Parity Collaborative, a group of newsrooms covering stories on mental health care access and inequities in the U.S. The partners on this project include the Carter Center, the Center for Public Integrity, and newsrooms in select states across the country. That's it for us today here on In the NOCO. We'll be back tomorrow with more of what's happening in Northern Colorado. Our executive producer is Robin Vincent. I'm your host, Erin O'Toole. Thanks so much for listening. We'll see you next time.